So, what is the economic impact of malaria to African governments? I pose this question to Dr. Lola, who is an epidemiologist based in London. Let's listen in.
Malaria is right in the center of the ecosystem of poverty. Malaria affects productivity in many ways beyond loss of lives. Absence from school, absence from work, the burden of caring by women and other carers of people who have malaria, aside from the chronic grief that attends the death of a loved one for malaria, all add together to make malaria a system booster and a system depressor.
Investing in malaria is similar to investing in development. Very interesting. So these additional economic dividends from that, what could they partly be used for?
1, economic development in Africa. 2, a reduction in the gap between the haves and the have-nots. Malaria is a poverty-related disease. It's related to poor rates. It's related to poor access to essential services. It means that there is a boost in economic activities from women, from children, and from the agricultural sector, which is a mainstay of African economy. 3, there's cross-sector productivity. What we would use that for is to boost our productivity, not only in the health sector, but across every important sector in development, from the private sector to public sector to manufacturing sector to educational sector will benefit from that improvement that we've made.
I actually want to pick it up from there. The zero malaria target. Is it possible to achieve this by 2030 in line with UN goals?
If you look back at the trajectory of malaria, many countries have begun to make progress with malaria elimination. And indeed, a couple of weeks ago, Cabo Verde joined the list of countries who have eliminated malaria. It is indeed possible. We have the tools, and the tools are increasing every day. More recently, we have a malaria vaccine, 2 malaria vaccines that are set out to be distributed. But we need to invest in malaria. We need to increase the financing for malaria, and we need to make malaria famous and change the mindset of malaria as just a disruptor to malaria as an integrator. This is what this report does for us.
Well, many thanks for staying with us. That's all the time we had for today's program. But you can get in touch with me and some of the team with your feedback on social media. I'm at Wahiga Mwara on X. Also check out at BBC Africa. Well,